WMFD.com. It is Coffee Talk with Jay Fox, sponsored in part by the Cove Coffee Shop in Ontario, Ohio. And today is the 20th day of January, 2021. And it is a very significant day for many reasons. But the reason that we're here with our guest, Reed Richmond from Richland Public Health, which is a lot of alliteration for anxious anchors, is to talk about the state of healthcare in Richland County. Yesterday, we crossed the 400,000 mark nationwide. Lanterns were lit on the reflecting pool in the National Mall in Washington, D.C. to signify a number that a year ago, no one could fathom. Reed, when you think about 400,000 people having succumbed to this pandemic, what is the first thing that goes through your mind?
First of all, the first thing that goes through my mind is that that number is almost unfathomable. And then you think that in the world there's 2 million. So that's how many people we've lost to this pandemic. But one of the thoughts that always occurs to me is way back in April, when we first were looking at the first things that were happening in the United States. At that time, we had a few deaths. New York was having quite a bit of a problem in New York City. It hadn't really exploded in other places yet. And I was online with my brother and some friends of his talking about the whole thing. And I was doing some math, and I said at the time that if these numbers that we were currently seeing held true, we would see 179,000 people dead by the end of the year. And nobody could believe that. They were just no way is that going to happen. So I was wrong by more than half. And I'm sorry that I was even that close. So the first thing I think about when I see that is all those people, all those lives we've lost, all the families affected. And I think that Biden did a really good job reflecting on that and mentioning those things, because when it affects any community, it doesn't just affect one family, it affects the whole community.
Absolutely. It's hard to look in the rearview mirror and have 20/20 vision and say, what could we have done differently? But do you think that back in February, if the entire country had been shut down for 2 weeks, 14-day quarantine, do you think we still would have seen the levels that we're seeing now? Was it just something beyond our control, or did we make a mistake?
Yeah, if I put on my rearview mirror goggles, I don't think it would have made a difference. I really don't. I think it was going to happen. It was going to get spread. The response that we had may have been a little bit slow, but you'll remember that looking back into March, that the governor closed everything down in March.
Mm-hmm.
And now you look back at that and you say, why did we close down in March? Did it really have that big an effect? Did it really stop things? Because what we found out was where we really needed to shut it down was later on in the year.
Mm-hmm.
At that time, when there weren't very many cases, the idea was, well, if we shut it down now, maybe we can stop it cold. Now you look back at that and say that it really didn't work. It really did not work, because it was still out there. And as soon as people went back and started doing things, it was going to spread. I don't really know if there was any point at which we could have closed things down and really made a difference.
That being said, we did close down, and the closure caused a lot of consternation, caused a lot of fear and a lot of anxiety, may not have had the desired result that we wanted. And the pandemic persisted, and we got into fourth quarter and we saw numbers spike at an unimaginable level. Thanksgiving led to a very rough December. The hospital census was at capacity. We are now 3 weeks into the new year. To what degree did Christmas and New Year's have an effect? Was it the same as Thanksgiving, or was it worse or better? Or
Well, you have to understand that when we look at Christmas and New Year's, you're always looking like two weeks down the road after those events to see if we're seeing an explosion in cases. Uh, we were very fortunate Thanksgiving that we really didn't see a big explosion in cases after Thanksgiving. So that was kind of a pleasant surprise. However, we did start to see cases after that. We started to see more hospitalizations, and that trend has continued. I don't know if New Year's or Christmas is going to contribute to that, but in Richland County, we're not seeing what they're seeing in some other states where they're really having a crisis, like in the big cities where they're really having a crisis where the ICUs are overflowing. We haven't seen that, although I think currently we have 48 individuals that are COVID hospitalized. We haven't seen as many of those going in the ICU unit. So that's a positive for Richland County anyway.
that being said, what's the prognosis for first quarter, Reed? Do we think that we're going to hit a level off, or are we still expecting to see a rise in cases?
Well, there's one really scary thing, and everybody needs to be aware of it. I mean, I know we shouldn't really try to scare people into doing the right things. We ought to be doing the right things anyway. But one thing that we have to do to be really cautious of is that the COVID-19 virus is mutating. Now, we always knew that there was a possibility that this would mutate. Most viruses do. And so there's a new strain of COVID out there. At this point, every indication we have is that the current vaccine will work against this new strain. But this new strain, which you may hear this as B.1.1.7, so B117. So what this new strain is. What they do know about it is it's much higher, much more contagious, has a higher rate of infection levels. That's currently almost every case they're seeing in the UK right now is from this new variant. So that's very concerning. The biggest concern is that it spreads much easier than the initial COVID-19. So we're going to have to be keeping an eye out on that. We do know that it is in 10 states. If it's in 10 states in the United States, it's going to appear in all the other states as well. So this is our big concern at this point, is when you get a virus that's even more contagious than COVID was, then we're going to have to continue to do those safety protocols we've been talking about since way back in February. Wear your mask. Yeah, wear your mask, wash your hands, social distance.
Wash your hands, mask, social distance. I think that's going to be part of our life for a very long time. When we learned of the mutation back in December, the news piece that I saw talked about the mutation, talked about what was happening in the United Kingdom, and then of course they cut to a shot of JFK Airport in New York and all the British Airways jets. And again, what steps need to be taken to isolate and prevent? Because if it started there and then all these people traveled here, well, surprise, we're going to have a problem.
Yeah, one of the most interesting things about this new variant is that they had a case in Florida who had no contacts with had not traveled overseas, this thing had just popped up like from out of the blue, and they could not trace back where he might have gotten it from, any visitor, any location he had been. So it's really curious about where this strain started, and is it something that just popped up from out of nowhere? The virus was going to mutate anyway. So even if there's a location where it started from, and the UK seems to be one of the big areas where it started from and is really exploding there, I think it's a possibility that that variant could have appeared anywhere at any time.
That being said, I have encountered more than a dozen people who have had the virus more than once. And that is another concern. Is that the truth? Did they actually have the virus twice? Is that possible? Or maybe they had an illness that they couldn't verify because the testing protocols weren't in place early, but then when the testing protocols were in place and they got sick again, it was the virus.
I think your second scenario is probably the most likely thing. We have not, we have a very few verified cases where somebody got reinfected after they had an initial case of COVID. What the thought process is on that is that the first case that they had was so low that they didn't build up enough of them. When you have a virus, your body naturally creates its own fights off its own defenses to fight off that virus. And it may have been such a mild case that those person's bodies really didn't fight off. They fought it off, but they really didn't create enough immunities for it for the next case. And so it may have been, that may be what we're looking at with some of those cases, that the first time. The other thing may have been they may have had a false positive, which led them to believe they had COVID, and then the second time they really did have it. So
what is the difference, Reed, between the rapid test and the more involved test?
The main difference is you're getting a more, and I'm not a medical person, so let me try to put this, they're getting a more accurate sampling by using a better test. When they do a nasal swab, there's always a possibility you didn't go deep enough, they didn't get enough of a culture to actually get a test. When the rapid test, there's two different types of tests they do. They do the nasal swabs, you can do the rapid test. There's also a blood test involved. Each one is a little bit better than the other one. And so, and again, I'm not a medical expert, so I can't really describe this. I had a nurse here. She could fill in for me and tell you exactly what that was.
Well, regardless, it is important to continue to maintain the protocols. And what constantly causes me to scratch my head is, despite all the warnings and the data and the testimonials of people who have had the experience, people are continuing to not adhere to the protocols. They're going out in mass, they're not wearing their masks, they're not socially distancing. And even if they don't care about themselves and their own personal health, what they're doing is they are putting other people at risk. How do we address that? Because to me, that's a moral issue.
Jay, I kind of agree with you that there's a civic responsibility that comes into this. And somehow I think we've forgotten that. Part of it is because this whole thing became political. And that's a sad fact, is that they politicize this virus. The virus doesn't care what party you believe in or what line of thoughts you believe in. So if anybody has any questions, they can email me. I can show you a document that I have that has 20 scientific studies that have been done that prove that wearing a mask works, is effective against the virus. One of the scariest thing about this new variant is not only is it more infectious, but when somebody is yelling, singing, or even just talking out loud, the spray from the virus is going to get in the air. It's these little molecules that float in the air. In this new variant, they tend to be smaller molecules. They tend to hang in the air longer. So you may enter a place where there's a number of people there, and if they don't have masks on, there's a chance that those molecules are hanging around in the air. They stay around in the air for several hours. So one of the things we're telling people now is when you wear your mask, make sure you have 2 layers of protection. The tighter the weave on the mask is, the better you are.
Well, that was my next question, because there's so many different types of masks out there. How do you know which one is the right one? I mean, here's an example of a heavy cotton cloth mask from TGI Fridays, then here's an example of uh, almost a thinner mask that has breathable airflow. And then there are the disposable masks with the blue that you wear on the outside and the white. How do you know which mask is right?
Well, the absolute best mask you can have is an N95 mask.
And where do you get
Now,
that?
the N95, they are available. We're still telling people though that you probably should have, if you can find a manufacturer who makes those, we're still telling people that the N95 mask is for medical grade material. So that should still be reserved for those people who need it most, the PPE protective equipment. And that's one of those things that doctors and nurses need. So, but there are some people that still, you can still find N95 grade mask on the internet. So those are the best masks you can get. But we're telling people, look for a mask that has a couple of layers of protection. So if you have a second layer, like a little insert that goes in there, that's better than just a simple cloth mask. Those masks are going to be better than the gaiters that you see people wearing that you pull up over your nose and go around your neck, and you can pull up over your nose. Most of those are just made of a simple cloth material. They don't really have as much protection. The most important thing though is if you're going to wear a mask, you have to wear it properly. It has to cover your mouth and your nose. Remember, you breathe in and out through your nose as well as through your mouth. So you have a chance of getting those microbes out of and floating in the air. So when you go into an environment where there's lots of people, if you see lots of people that aren't wearing their mask, that's a much more dangerous environment, because with this new variant, the molecules are going to hang in the air for a longer time. So even if you have a good mask on, you'll still be walking in an area where there's more of the virus present.
So basically what you're saying is, by participating, we're literally playing Russian roulette. We don't know what we're exposed to. We don't know what we may get or we may not get. And it's possible that not only are we putting ourselves at risk, but we're putting other people at risk just for the sake of throwing caution to the wind.
Yeah, exactly. And again, if you're going to visit an older person, maybe a family member, or that's the reason, one of the reasons they don't allow people to go into nursing homes anymore, is because we don't know who's sick and who isn't. And it's even important, even after you've had your vaccine shot, is to continue to wear a mask. Not you could stick once you have the vaccine, even if you've had the second dose, the booster dose, and you're completely vaccinated, although you may still be able to fight, you're still going to be able to fight off the virus yourself. It doesn't mean that you could not expose another person. So you may still be able to expel those microbes even after you've had your vaccine shot. So it's very important for you to continue to wear your mask. And I know people are just absolutely tired of this. I can't go out. I can't do anything. Everywhere I go, I got to wear a mask. I don't like wearing the mask. They're uncomfortable. This is something that's not going to go away for a long time. It's going to take well into the summer before we get enough people vaccinated in this country to really make a difference. And so we're going to have to wear a mask, right through the summer.
And what you're saying is that even with the vaccination, there will be a period of time after the vaccination where you still may cause present harm to others.
That's absolutely correct. If one of the things that we tell people when we do the vaccine here at Richland Public Health is continue to wear your mask. You're not actually safe for about 2 to 3 weeks. It takes a while for your body to build up that immunity to fight the virus off. So 2 to 3 weeks is for most people what it takes. There have been cases of people who got their COVID vaccine and 3-4 days later they caught COVID because the body hadn't built up the immunity yet.
Right. So let's talk about the vaccine for a minute. What is the current rollout protocol? How does one know? It's kind of like flying on Southwest Airlines. Are we in the A group, the B group, or the C group? Are we in 1 through 30 or 31 through 75?
Yeah, well, the majority of the people right now, you're in the C group, which is
That's right.
just way down
Good luck.
the road.
Be in the middle between two very aggressive people.
Yeah. Well, one thing to notice that there's no health facility that has the vaccine that doesn't wish they could get in the arms of everybody who wants to get the vaccine. We just do not have the allotments yet to be able to vaccinate everybody who wants to be vaccinated. Now, the governor's protocol, we went through phase 1A, which was medical responders. And so most of those people have been vaccinated. If they didn't get vaccinated first and they missed their window, there are still a few places they can go that will still get their vaccine to them. But most of the facilities, most of the locations that are providing the vaccine have moved on to phase 1B. They started phase 1B with people 80 plus. Then next week we'll go to 75 plus. The week after that we go to 70 plus. The week after that we go to 65 plus. Added into those two groups is in that second group is also people with developmental disabilities and some medical lifetime medical problems. And then in the last group, we add in the teachers and the school employees, which adds another layer of people to those lists. Now, if you were 80 plus and you missed this week or you didn't get in, you can still get in any week moving forward. It wasn't like you missed your only week that you could get the vaccine. So anybody in any of those age groups can continue to get the vaccine when they find a place that has it available.
So, Reed, I'm 52 years old. My birthday is May 10th. Will I be vaccinated by May 10th?
I would say, boy, I'm gonna say it'll be tight.
Yeah.
It'll be really tight. Right now, we just don't have the vaccine allotments, and this is a nationwide problem. It's not that there's. At one time, we thought they were holding vaccines back. That proved not to be the case. That all the vaccines that we have out there have already been delivered. So we're getting them delivered on a weekly basis. What that means is in Richland County, for example, for the 80 plus group, we had 1,650 doses total. In Richland County, there are almost 6,000 people who are 80 plus. Mm-hmm. So that makes it really difficult to make sure that everybody who wants one can get one. We're going to have to ask people to be patient and continue to try those lines, and you'll be informed whether or not you can get in a slot. We have on our website, richlandhealth.org, the first screen that you'll see has a vaccine registration on it. If you scroll down, it has all the information for us at the top, but if you scroll down to the bottom, it'll show you all the people that are providing vaccines.
More time.
Yeah, our website is richlandhealth.org, and on the first splash screen that comes up, you'll see a thing that says vaccine registration. If you click on that button, it'll take you, and just about halfway down, you'll see that link to ODH. That's the easiest way that you can get to it. There's so many steps on their website to get to that particular link. So that'll get you there. And at the bottom of our website, you'll see the list of all the providers in Richland County.
Terrific. So a lot of people are asking the question, which vaccine to get? Pfizer has one. Monsanto has one. Others are coming out. What is the difference between the brand names, if you will?
What the two that we're using right now, and at the health department, we're using Moderna.
Moderna, that's right, not Monsanto. Right. So that's for agriculture.
Right. The Moderna vaccine, the big difference between Moderna and the Pfizer vaccine is the Pfizer vaccine is the one that has to be kept at a really ultra low temperature and when they get it out of that temperature, it has to be used within 24 hours. The Moderna one you can keep in a regular refrigerator, freezer. It doesn't have to have a low temperature capacity. So the Moderna one is the one that we're using. The places that are using the Pfizer vaccine already have those refrigerators in place, those freezers to get that ultra low temperature. as far as the vaccine difference, there's very little difference between the two. When you get your second dose with the Pfizer, it's 21 days later. With the Moderna, it's 28 days later. Both of them have about 90% protection on the first dose. The second dose that you get is just like a booster to get shipped about 95%. Of all the vaccines that are out there right now, these two, through the tests that they've done, look to have the best results. We're in the 90% area. There are some other vaccines out there. The one I know that they're using, there's a variant that they're using overseas that gives about 76% protection. So we're very fortunate to have the Pfizer and Moderna doses because they do show such a really good return on the virus.
But there's nothing that's 100%.
What's that?
There's nothing that's 100%.
No, there's nothing that's 100%. Of the people that have taken the vaccine so far, and we're up in the millions now that have gotten across the United States. There's only been 3 cases of people having severe reactions to it. But there's been 90 total cases of people who had a reaction, allergic type reaction. Of those 90 cases, every one of them had previously bad experiences with a reaction to a vaccine.
Okay.
So, right now, what we're seeing right now is that there's hardly been anybody who's had a bad effect from taking this vaccine.
So there's no cause for alarm.
Well, that's what we're saying. We're telling people there's no cause for alarm. I know there are people out there that are, the anti-vaccine group that are warning people about this problem or this problem. Most of the stuff they've been saying is a myth. But use your judgment. The only thing I would say, Jay, is that if you compare the 40,000 people whose lives we've lost compared to the minute possibility that somebody might die from the vaccine, I mean, the percentages are obviously way in the favor of getting the vaccine.
Sounds like the vaccine's a better gamble than going out to the bar on a Thursday or Friday night and walking into a group of people who aren't wearing their masks.
Well, yeah, I think that's obviously the case.
That's right. So, Reed, in conclusion, because we cannot say this enough times, what steps can we encourage the general public to take to remain safe?
It's important for people to understand that we're going to have to be patient to get through this vaccination process. We don't have the allotments. Nobody in the United States has enough to vaccinate everybody who needs to get it. So until the time that your group comes up and you can find a place that you can register to get the vaccine, you're going to have to be patient, and you're going to have to continue to do those things that we've been talking about. Avoid large groups, social distance when you're in a small group and talking to people. Make sure that you're keeping that distance. That when they say 6 feet, that's at least the minimum is 6 feet. Wash your hands. If you don't have access to soap and water, use hand sanitizers. We used to put a big emphasis on sanitizing surfaces. What we found is that it doesn't stay very long on surfaces. So it's still a good idea. Those frequently used items like telephones and cell phones, and still a good idea to sanitize those regularly. But wash your hands, soap and water for 20 seconds. And then, of course, the most important thing, we keep saying this on and on and on, is to wear your mask anytime you go out in public. If you're going to meet somebody, if you're going somewhere, wearing your mask is the best thing. When I leave my office here, and I'm in a very contained office area, the first thing I do is pick up my mask and put my mask on, because I'm going to run into people when I'm walking down the hallway. So, and trust me, at Richland Public Health, they'll have their mask on too. So we continue to emphasize that: wear your mask, do those precautions. And we're going to have to be in this for the long haul, Jay. So, continue to wear this. And even after you've gotten your vaccine, make sure that you're still wearing masks to keep people protected.
The majority of our conversation today has been about COVID-19, vaccines, the mutation, practicing social distancing and safety procedures for the future. But the last thing I want to address is the mental health aspect. Richland Public Health is an organization that is not just here to serve us through a pandemic, but the total scope of our health, physical, mental, spiritual wellness. I sit on the board of the Know It Before You Need It campaign, the 211 system in the community. And I think a lot of people are suffering right now in spirit for a variety of reasons. What are some of the things that the health department is recommending people do to take care of their mental health so that they don't make the wrong or dangerous choices because they just simply can't stand the isolation anymore?
Well, Jay, the first thing I'm going to say is not about those people that are suffering from depression or through this have mental health problems. The first thing I'm going to recommend is that if you know somebody, if you have a friend that you haven't talked to, your next door neighbor, your parents, call them. The most important thing is to be able to talk to somebody. If they feel isolated, they're going to feel alone and in this against the entire world. So the most important thing that you can do is call those people, call your friends, talk to people. That's the most important thing, that they don't feel isolated. So that's the first step. For those people that are feeling isolated, that are feeling that they're at the end of their rope, there are resources here in Richland County to help you. Call those hotlines, call the mental health board, call 211 and get some help. Don't feel like you're in this alone. I had talked to Bob Ball, who's the investigator with the coroner's office, and he also put a really big emphasis on this calling people, make sure that you stay in touch, that you don't leave people isolated, because that's when despair sets in. So we're very aware of issues that involve depression, and do what you can to help out. So if everybody in Richland County made a commitment to call somebody tonight, that would make a huge difference.
Absolutely. Our guest today has been Reed Richland. I want to call you Reed Richland just because it's Richland Public Health. Reed Richmond from Richland Public Health.
And Jay, I live on Rainy Road. That doesn't help things either.
It just goes from bad to worse, doesn't it? Reed Richmond from Richland Public Health. And let's give that website address one more time, just so that the public can use the resource when they need it.
Sure. It's just richlandhealth.org. And the first page you'll come to is about the vaccine registration. And the second page on the slider at the top is about questions and answers for COVID. So both those are, and we have links to all other kinds of resources there. So please feel free to access that. We regularly update information on Facebook as well. So if you haven't liked us on Facebook, do that, and we'll stay in touch that way.
All right. We appreciate your time today, and thank you very much for watching and listening. You've been watching Coffee Talk, a service of WMFD TV News, available at WMFD.com. And again, thank you to Reed Richmond for being our guest today. Thanks so much for watching.
Thank you, Jay, and thank you for getting the good information out.